Students don't just remember what you teach, they remember how you make them feel. A kind word, an understanding heart, and a patient approach create a learning environment where students feel valued and supported. Happy Nurses Week, colleagues. If you're watching this snapshot when it was released, then you're celebrating Nurses Week, as you rightfully should. Maybe some of you all are nursing students. We want you to get in the habit of celebrating Nurses Week. Nursing is a calling. It's a special profession. And despite what political conversations may be happening, we know the value that nurses bring to the bedside and to other healthcare areas to make sure that we are using evidence-based practices to help our patients get better. Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educator colleagues on the journey to achieve excellence. For some of you, that means achieving your CNE, others maybe your CHESI, or we may have some nurse leaders that are watching, or even some nursing students. When you look at the role of a nurse educator as described by NLN, included in the nurse educator competencies, you will quickly see that all of us are nurse educators. Now, we may educate or facilitate learning in a different way. Maybe oftentimes it's informal, other ways it's more formal. When we're a nursing student, we learn how to be a good educator. How do we make sure our patients understand the information that's going to help them have great patient outcomes? And that's what we continue to do as a nurse educator. As a formal nurse educator, we want to make sure that our students have great outcomes and that they're able to make safe patient care decisions. Well, let's talk about this really important decision, okay, before we move forward. And you see on the screen here, CNE in 60 days. We're talking about lecture, we're talking about NCLEX failures. So when you're on the journey to achieve that passing score on the CNE exam, we know it can easily become overwhelming. We want to talk about resources to help you along the way. So the first one I'm going to talk about is Billings and Halstead, Teaching and Nursing. This is the 6th edition. This is going to be your primary text to make sure you close your knowledge gaps. It can be you can get easily frustrated also when you're on the journey. I started our conversation today with a quote from my actual devotional. So I released the devotional just for nurse educators earlier this year. That's what keeps me connected. That's what keeps me grounded. And if you're one who needs a resource that will keep you grounded and focused on your why, the devotional, although it took me 2 years to finally commit to developing it and writing it, it's all about staying centered in your why. We know that as nurse educators, there's a lot of competing priorities. And that's what we're going to talk about, NCLEX failures. All right, so let's go there first. This is what we know about NCLEX failures. Well, depending on who you talk to, you may hear that, NCLEX pass rates are going down. Well, actually, when you go to the NCSBN website, you will see this data. As of right now, and this data was last updated May the 3rd, the first time U.S. educated pass rate overall is 86.3. And if you go to the NCSBN website, in fact, let's just go ahead and go there together, you will see that it's not too much different than it's been in the past. So the message I want you to take away is to make sure you have accurate information. All right, so I'm going to share my screen. You will see here that the statistics in 25 are not a whole lot different. For the entire year, it was 86.7. In 2024, it was 91.2. 2023, it was 88.6. 22, it was 79.9. So when you hear colleagues say, I heard the NCLEX pass rates are going down, that's not necessarily true. When we're on this journey to achieve success with our students, because we know that students don't go on this journey alone, right? We're there to support them to achieve their success. It's important that we use the most current information, and that's going to be the NCSBN blueprint, okay, or the test plan. So make sure when you're writing your exams, when you're developing your blueprint, when you're looking at curriculum changes, make sure you're going to that NCSBN test plan. And then let's talk a little bit about lecture. I know that sometimes we can hear mixed messages about the lecture process and how little we should be lecturing. Okay, so this is what data tells us. This is what the research says. When it comes to engaging in what's called the adult learning theory, one of the theorists that's most well known is going to be Malcolm Knowles. His work talks about the role of us engaging in self-directed learning to make sure we're closing our knowledge gaps. It's also a collaborative process because we're partners with our students to make sure they're closing their knowledge gaps. Now, this work most closely aligns with actual David Kolb's work. So David Kolb talks about the importance of engaging with our students to have these hands-on experiences, to give them feedback, and then students make corrections based on the feedback we give them, based on the evidence, based on the knowledge that they have, the cognitive learning journey that they go on to make sure that they are closing their knowledge gaps and making those safe patient care decisions. If you're already thinking that this sounds familiar, you're absolutely right, because this aligns with the clinical judgment model. So lectures do have benefits. In fact, we want to make sure when we're looking at the didactic content from a cognitive learning standpoint, we want to make sure that students are given factual information that will help them clarify their muddy points and make safe patient care decisions. Okay, so again, we've talked about 3 elements. Number 1, when you're on the CNE journey, make sure you have accurate information. Okay, so you're going to make sure you're using Billings and Halstead as your primary textbook. Step 2 is you're going to go to the NCSBN website, make sure you have the most current test plan, making sure you're looking at your curriculum and making changes that are necessary to ensure there's alignment. And then the third point that I want you to take away is to go to the data, go to the research for yourself to validate information. Okay, so don't always take others' words, even though they may have the best intention. Go to the source, go to that primary source, just like we tell our students, so that you can have accurate information. Are student failures increasing? Well, it depends on who you ask. And of course, every nursing program is different. So that's the other consideration you want to remember, is that you want to look at your own data. Okay, so if you hear other colleagues saying, oh, more students are failing, that could be true. What's most important is that students understand what their muddy points are and that they're closing their knowledge gaps using primary resources, that we as faculty are giving them consistent feedback, continuous feedback in a timely manner. I like to say early and often when it comes to feedback. That's the strategy that's going to help our students be more confident in their ability to make safe patient care decisions. All right, so could it be that we're seeing an increased failure rate on NCLEX at our individual institutions? Absolutely. And that's something obviously that all pre-licensure programs track, and graduate programs too, if there is an exam that is required in your program. The other topic we're talking about today is faculty turnover. Is it increasing? Well, that's a fact. And if you go to the AACN website, you will see that there are reports that talk about the vacancy rate. As of last year, it was 7.2. That information is always updated. So AACN is another great website, and we're going to go there next. So let's talk a little bit about how to prepare for faculty turnover. Do we expect more retirements to occur? Yes. Are there questions on the CNE exam about the attrition that we're seeing in the academic setting? No. However, what you do want to focus on is our ability to acclimate our novice nurse educators to the academic experience. And what that's going to look like is mentoring, continuous learning process. We have to take accountability for our learning as well when we are in a novice nurse faculty role. And we do that by, first of all, doing an honest assessment of where we are today. What are our knowledge gaps? If we all reflect on our first teaching responsibility, it was probably pretty overwhelming, especially as you tried to understand curriculum. If you went to a curriculum committee meeting, it probably sounded like alphabet soup or a foreign language. I know that we talked about that in our recent CNE in 60 Days cohort, and that was a unanimous 5. So we always like to do what we call a temperature check when we're engaging in our 60 Days cohort or even our master classes. So we like to know on a scale of 1 to 5, how confident are you with the knowledge? So all of us go through a learning curve, and that's going to affect the ability for us to ensure that our students are able to facilitate and really engage in this active learning experience that we need for them to have. So yes, our students should be facilitating in discussions we're having in the classroom. We're not the only facilitator, right? We want to engage students in practicing and having conversations about the clinical concepts that we're discussing in class. Patricia Benner talks about the importance of bringing those clinical experiences into the classroom. So what could that look like? Unfolding case studies, also role playing, bringing in that equipment into the classroom so students can actually have some kinesthetic experiences, right? Some tactile experiences so they don't have to wait to engage in clinical learning, hands-on experiences, experiential learning, just like David Kolb talks about. They don't have to wait until they get into the skills lab or the sim lab. They can engage in the classroom. All right, so I know we talked a lot about that specific concept, but I want to make sure that as we're talking about faculty turnover, you're clear about what concepts you need to focus on when it comes to the CNE exam. And of course, you're going to go to the NLN website and click on the candidate handbook for the exam that you're going to take to make sure you have an increased knowledge level about concepts that you need to focus on and that you're clear about those that you don't need to focus on. All right, like we've been talking about a little bit during our time together today. Okay, so I mentioned earlier going to the AACN website, and that's where we're going to go next. So let's go there together. And then we're going to come back to this snapshot that I'm showing you right now. Okay, so let's take a look at the website. Specifically, I want us to focus on the essentials part of the website. Let me make this large screen for everybody. When it comes to the essentials, we know that there were updates, even if that's a point I should have said earlier. So even if you are not a university, a college that's accredited through AACN, these essentials are still really important, okay? You want to make sure that you have an understanding about these competencies. Accreditation, absolutely, you want to look at those standards because there may be different language. Oftentimes the sequence is different, but ultimately it's pretty much the same expectations when it comes to the quality of your nursing education program. It's just a matter of which accrediting body is going to come to your campus, make sure you're aligned with their standards, and make that decision about your accreditation. So why are we looking at the essentials? Well, oftentimes what we see published by AACN drives the other accrediting bodies. I'll give you one great example. When it comes to the ACE model, the ACE framework, access, connection, and engagement, you see that right here. Well, NLN released a statement a few months back, and they talked about the alignment with the ACE framework. Now, NLN, we know, has their own accreditation. They have their own accrediting department. And because this was announced by AACN, they have now talked about how it aligns and any changes that they're making to the NLN standards that they are using to determine whether or not the nursing programs that they accredit have met the standards. All right, so that's why you want to stay connected with AACN. And this resource that we're looking at right now, the Essentials website, this is free information. Even though I'm a member, this is still free information that you have access to. And you can decide as a campus, as a college, which components you're going to adopt based on your accreditation, based on your board of nursing, and what you feel like are the opportunities to help your students be more successful in your program. The essentials are not new, so they were previously released in 2021, and now you will see that the 2026 edition is available. You can click on this link and there's a toolkit. There's a lot of resources that are going to help you navigate your way in determining what pieces of the model or framework you're going to integrate, you're going to adopt, and what it means to your nursing program. What's changed? I love this section because it really does give you a nice screenshot about what's different, especially if you are accredited by AACN or you're following the Essentials framework. So it tells you here the competencies that were updated as well as the sub-competencies. And then there's this great overview video from the Chief Access and Engagement Officer. So again, what we want you to do is stay current with the information that is coming from these accrediting bodies. Even if you're not accredited by the specific organization, it's still really good information for you to know, because you want to make sure that as you're making programmatic updates, that you are aligning with the changes either that have already been published or that are soon to come out. All right, so you definitely want to stay connected with AACN. This just talks about the importance of alignment. Now, alignment is key. We know with any accrediting body, they're looking for 3 essential components, okay, just to start with. Alignment between your actual course learning outcomes and your programmatic outcomes. So that's an important step in the process. And then you want to make sure when you're looking at the assessments, the evaluation strategies, that they are aligned with your learning outcomes, okay? And then the third component is the actual progression indicators. How do we know that a student, when we always level our programmatic outcomes as well as our course learning outcomes, and we want to make sure that we have clarity in our systematic program evaluation. We want to make sure that we have clarity about how we validate scaffolding and that the prior learning level has been met. Okay, so if we have, as an example, 5 different course learning outcomes associated with just one of those end of program outcomes or programmatic outcomes, then you want to make sure that you've identified how many levels you have, whether it's 2, 3, or 4. You want to make sure that you have specific progression indicators, or how you're validating that level 1 has been met before you go to level 2, before you go to level 3. Okay, so that's a really important part. Now, if this is high level and you have no idea what I'm talking about, that's okay. Just know that Billings and Halstead has great chapters on curriculum, and that's going to help you have clarity regarding alignment. Now, with this specific screenshot that you see here, this talks about alignment with the essentials and the ACE framework. NLN also talks about alignment with the ACE framework. Okay, so whatever accrediting body that you have aligned with, you just want to make sure that you are clear about changes or updates that you need to make to your curriculum to ensure that there is alignment. Competency-based education, I know that continues to be a hot topic for many colleagues, and this is what we know about competency-based education. It's a different way of thinking when it comes to validating whether or not competencies, whether or not mastery has been achieved. We want to make sure that the tools that we are using to validate learning, that they are indeed valid and reliable. We also want to make sure that we're mapping and that we're aligning to specific learning objectives, student learning outcomes, and our inter-program outcomes as well. All right, so when it comes to competency-based education, deciding if your program is thinking about moving to competency-based education, you want to make sure that you understand what resources are needed, number 1. Step 2, what is that timeline going to look like? Oftentimes, it can be quite a bit of work to move to competency-based education. So you want to be clear about what that plan is going to realistically look like for you all to make that move. All right, so what about the limited faculty development funding? Well, we know that's a challenge too when it comes to our ability to achieve success with our programmatic outcomes, looking at our end of program outcomes. NCLEX we know is one indicator, and we know that there's other formative assessments that are done before students even complete those summative assessments, knowing that NCLEX is the ultimate summative assessment to validate that students are able to make safe patient care decisions. This is why so many of the questions are aligned with the level of application, because we don't want students to stay at that lowest level of cognitive learning, which is memorizing or remembering, even that next level, which is understanding. Students have to progress. They have to be able to engage in application, in analysis, and ultimately creating, which is that highest form of learning. And then we look at the psychomotor learning domain as well. We know that when it comes to students' first time engaging in a clinical skill, then oftentimes it's imitation, right, that they're engaging in because they watch us demonstrate inserting a Foley, and then they engage in inserting a Foley, and we give them feedback. Ultimately, we want them to get to that highest form of psychomotor learning, which is, you guessed it, naturalization, right? And the definition sounds just like it is, right? Naturalization. We want students to be able to naturally follow the steps of inserting a Foley using sterile technique. All right, so when we have limited faculty development funding, this is what we want to do. Look for internal resources. Oftentimes, our colleagues, our peers, sometimes our deans have advanced knowledge. When you look at the Boyer Scholarship Model and the 3 types of learning that happens at the teacher level, which we know is the highest form of learning, is teaching, you will see that there's actually 3 levels when we talk about the scholarship of teaching. So our ability to really share with others our expertise, our scholarly knowledge, that's level 3. It allows us to share with our colleagues so that they can improve their educator practices. So don't let that be a limiting factor. Let's be creative and look at the resources that we do have. Mentoring and student success, as we mentioned earlier, this is essential when we talk about engaging with our novice nurse faculty, even when it comes to a novice skill, maybe when it comes to writing an abstract or submitting a manuscript, that's a novice skill for you. There are other colleagues that you're working with, or even through your professional organizations, that you can tap into to help you decrease your anxiety, increase your competence and confidence so you can achieve that goal. Same thing with our students. We want to help them achieve their goal as well. All right, so as we wrap up, we want to take a look at our thought-provoking questions. And I didn't even mention that you should have printed out your study worksheet, which is right here in the description. So every single time you join us, make sure you're printing out that study worksheet, because we want you to put 2 important data points on there. Okay, so the first data point is, what is today's date? Whatever date you're watching the snapshot. The second information we want you to put on your study worksheet is an objective. What was the takeaway you wanted to walk away with today? Maybe you wanted to learn more about where to find information regarding NCLEX pass rates. Well, now you know exactly where to go. Or maybe you wanted to hear more about essentials and what changed. Now you know where to go for that information as well. All right, so let's take a look at this thought-provoking question. We're actually going to do 2 during our time together today. So how can nursing faculty best prepare for integrating interprofessional education into their teaching practices? A, focus on meeting specific accreditation standards and alignment with requirements. B, collaborate with non-nursing disciplines to develop shared curricula. Or C, maintain traditional lecture-based delivery methods to align with the nursing program's mission. When you get to the CNE exam, you want to have 2 questions to consider, okay? So the first question is going to be, what is this question really asking me? The second question is going to be, what is it that I know for sure about concepts that are included in this question? If you have no idea, the goal is that you get to at least the top 2 options, okay? Knowing that only one is correct, and there is probably going to be a really close second, okay? So if you can at least narrow it down to 2, hopefully you'll be more likely to choose the correct answer. All right, so let's take a look. I want you to think about those 2 approaches for every single question when you get to the CNE exam. So what's your answer? Go ahead and write it down. And most importantly, we want you to write down your rationale for the correct answer and the incorrect answer. You can always pause this snapshot and come back. So if you chose B, collaborate with non-nursing disciplines to develop shared curricula, give yourself a round of applause. All right, so now let's talk about the rationale. Collaborative curriculum development ensures nursing students engage meaningfully with peers from other disciplines. This aligns with the NLN's focus on fostering collaboration and competency in interprofessional education. Options A and C do not adequately address the comprehensive nature of IPE. So if you didn't choose the correct answer, we just want you to take a moment to pause and reflect. What attracted you to option A or C? And what information do you need to look at a little bit deeper in Billings and Halstead to help you clarify your muddy point? The number one reason colleagues are not successful on the CNE exam is lack of proper preparation. We've seen it time and time again. But that's not going to be you, because you're going to properly prepare. You're going to make sure you're using Billings and Halstead as your primary textbook. We call that the Bible for nursing education. And you're going to make sure that you're spending ample time going deeper in having a comprehension of the concepts, not just memorizing, but being at that application and analysis level, because 70 to 80% of those questions on the CNE exam are going to be at that mid to upper level. Okay, so again, you want to pause, reflect, and then act by looking at the resources to help you close your knowledge gaps. All right, so let's take a look at another one. I know, bonus thought-provoking question for this snapshot. You are introduced to learning circles during a workshop on effective teaching strategies. The instructor explains that these circles leverage Kolb's learning styles to enhance student engagement and learning outcomes. Kolb's learning styles are often applied to the concept of learning circles. Which type of learning theory does this approach align with? A, Constructivism, B, Behaviorism, or C, Humanism? We talked about David Kolb during the snapshot. So if you need to pause and write down your rationale for the correct answer and incorrect answer, feel free to do that. If you chose Constructivism, give yourself a round of applause. You are correct. And if you didn't, I don't want you to stress out, because here's the reality. We don't write any questions for the NLN CNE exams. That would be a conflict of interest. So don't stress out if you didn't choose the correct answer, okay? It's most important that you understand the rationale. And this one is definitely at that level of memorizing, first of all. So you have to understand, what are the learning theories, okay? So we're going to help you by giving you a reference, okay? So table 14.1 in Billings and Halstead 6th edition is going to give you the 5 main categories. So there's 5 main categories of learning theory that you want to focus on. And you're going to see a lot of great information about the why. So why is that learning theory so important in nursing education? Second of all, the what. What are those teaching strategies that are mostly aligned with that learning theory? And then third of all, when we talk about the what and the why, it's also the how. How do I, as a nurse educator, bring that learning experience into the classroom, not only to align with the theory, but also to help my students have a deeper understanding of concepts that we know are essential for them to learn, because that can be the difference between life and death when it comes to students making patient care decisions. So what else is it that we know about constructivism? Well, it's all about how students construct meaning of the information that we give them. That's why learning circles are so effective, because students get to learn from others. They also, and what we know about this specific learning theory, they also get to create context, right? They get to make meaning of the situation if we have unfolding case studies, or if they have literature articles that they're bringing into the classroom and they're discussing them with each other. They're able to learn from each other. They're able to leverage knowledge that their peer may have, or maybe their peer has a different way of explaining the concept than what we did. So constructing meaning, making meaning of the information for themselves. And then second of all, putting it in context. Understanding sterile technique is relevant for central line dressing changes, and it's also relevant for inserting a Foley. Okay, that's contextual. And then learning occurs in social activities. That's the other component of constructivism. And it is a type of cognitivism as well. So when you look at table 14.1, you'll see more in-depth information about constructivism, and that it's a subcategory, a branch of cognitivism. And you think about it, it makes sense, right? I just gave you a couple of examples. The ability for students to really translate the fact that sterile technique is used with central line dressing changes, and also inserting a Foley. Well, they have to understand what sterile technique is, right? That's a really important part before they're able to pull the ideas together, the steps together of exactly what they should do to make sure that they are providing safe patient care. So same process, you want to pause, you want to reflect, and then you want to act. Your ability to make sure you're closing your knowledge gaps first starts with having the right resources. Second of all, having the time, dedicating the time to close your knowledge gaps so you can show up as an excellent nurse educator and move forward on your journey to pass the CNE exam. It only takes 60 days. I know that may sound like a lot for some of you, but for me, it took me almost 8 years to finally get the CNE exam off of my bucket list. There's no need for that. We at Dr. Sellars Educate provide a consistent community of support, only using evidence-based strategies to help you achieve success. The only way you won't achieve success on a CNE exam is if you quit. We're here to support you until you are successful, no matter how long it takes. We hope that you enjoyed this snapshot. Happy Nurses Week, and we look forward to seeing you in the next one. Have a great one, everybody.